I think I introduced you as talking about menstrual health and endometriosis, which wasn't true. You were talking about menopause. But our next panel is going to be talking about menstrual health and endometriosis. And I'm so glad, I mean, I'm absolutely not surprised to see this come up as a topic here. I'm so glad it is. I am somewhat befuddled and deeply ashamed to say that probably 5 years ago, I had no idea what endometriosis was. No idea. And of course, you know, I'm a woman with many women friends. It just wasn't something that was brought up or spoken about. And I have a dear friend who's very, very close to me who has had endometriosis for 25, 30 years. And I only realised it a few years later and thought, oh my God, you have been going to work like the rest of us, month in, month out, dealing with this, and absolutely no one, not even your closest friends, who I count myself as, had any idea. So I'm so, so glad that we're talking about this. And without further ado, I'm going to introduce our next panel. I might get them to come up onto the stage actually and introduce them while they're sitting down. So Dr. Talat Uppal, Rochelle Lake and Julie Snook, come on up, and moderated by a senior journalist at Women's Agenda, Olivia Cleal. Come on up, you four. So I'm going to start with Dr. Talat Uppal. She is a Sydney-based gynaecologist and the director of Women's Health Road. She is also the CEO of Bleed Better, which is a charity for those with heavy menstrual bleeding. Rochelle Lake is the head of B2B marketing at Essity Australasia. Now, they are a global leader in hygiene and health products, so they sell and manufacture leading brands such as Libra, Tom Organic, Modibody, Tenor, and so much more. And finally, Julie Snook. Julie is a multimedia professional. She's worked at major television networks and has been in the Australian media for 18 years. She's also an Endometriosis Australia Ambassador since 2018, where she speaks to forums and mainstream media about the issue. This chat is going to be moderated by Olivia Cleal from Women's Agenda. So please put your hands together for our panel and moderator.
Thanks so much, Jan, and it's a real privilege to be here with such an esteemed panel, so thanks for having me. We're going to be chatting all things menstrual health today, and when we talk about menstrual health, we mean periods, we mean menopause as well, we mean endometriosis. It's still viewed as this topic that's something that's quite icky and gross, and we're really not supposed to be talking about it, but here we are up on stage about to do so. I might start with you, Dr. Talat. You're a gynaecologist. Why is there still this level of discomfort about talking about something that is so natural and so normal?
Thank you, Olivia. I think menstrual health basically is riddled with, unfortunately even now, taboo and stigma. And women typically, in general, still do not want to always discuss their issues, especially the line between what is normal and abnormal can be quite grey. So I think we've got centuries, and these themes are recurrent themes, aren't they? All day we've heard about closet, you know, things that are not, you know, out in the open. There are silence around it. There's taboo. And this can be heightened in certain communities even more, where there might be excessive shame. So, for example, women can be considered impure. There are certain communities in which women can actually not be in the house whilst they're menstruating, or cultural or religious-based norms that are still disadvantaging women. So I think it's so important, Olivia, to sort of break that taboo. And thankfully, with the newer generation, I'm reflecting that there is more openness. Social media, even though it can be a double-edged sword sometimes, is actually facilitating those discussions, and I think making it more easier. And as a gynecologist, one thing I find very heartening is that mothers who bring their daughters and say, look, I had the same problem. I didn't get support. I wasn't able to debrief. I wasn't able to get the medical support I needed, but I wanted to do different for my teenager. So we're hoping that that full circle will come through, and that women will continue to be supported with periods in a positive way. Because like you said, it is a natural space. It should be like breathing, or like eating, or like any other natural function. And of course, when it is not normal, that should be fully supported.
Yeah, it is all about breaking that stigma down and taboo, absolutely. And when you combine all that stigma and taboo with the lack of research into women's bodies, it creates this massive gap in the health system that is supposed to take care of us.
Exactly, and you know that we spoke about the typical person on whom the research is done, being a middle-aged white man, but can you believe that even the mice in the lab are actually male mice?
Oh my God. The patriarchy strikes again. Julie, I want to go to you now. You are an ambassador for Endometriosis Australia. I was hoping you could talk us through your experience with endometriosis and any challenges that came from that.
Oh, how long do we have? The clock says 41 minutes, but I could talk to that for a very long time. As you heard in that introduction, I am a media, I will use the term professional very loosely. I've been doing this for a long time now. I worked at the Nine Network for almost 10 years. I work at Sky News. I do a bit of PR these days as well. So I've been around for a little while, but I grew up in country New South Wales. I grew up as an only child. I grew up at a great Catholic school, all the basic, knowledge around sex education and women's health. So when I started to get quite sick as a teenager, consistently, in hindsight monthly, we're talking passing out, we're talking severe migraines, we're talking just laying in the bath for hours. I couldn't understand what was going on, doctor after doctor after doctor. And then finally at the age of 19, after me pressing my GP on, I think about the 5th visit, please let me go get a referral to a gynaecologist, which living in regional New South Wales isn't easy to access, so I had to travel to a different city to get to that appointment. It took, I was 19 when I was diagnosed with endometriosis, and it was the first time I'd heard that word. I had never heard the word, I had never been introduced to the word, no one around me had ever mentioned it. And when I was first told, look, I think this is what you have, but we'll need to operate to confirm, I thought, okay, well, sure, that sounds relatively straightforward. And it wasn't relatively straightforward. And it hasn't been all the other, I've had 13 surgeries now over the past, let's not count how old I am, the past few years. Which is, as you would know, doctor, not the norm and certainly not what we encourage. And so I, to be honest, didn't really start talking about my experience, my situation, until probably 5 or 6 years ago when I was working at Channel 9, and basically because I got fed up. I got fed up with having to put on a brave face. I got fed up with having to whack on the makeup and stand in front of a camera and be okay when I wasn't. And I got fed up of really keeping it from friends and from family, as we heard a little earlier. Some of my best friends didn't even know I had this condition. My family members didn't even know I had it. So for me, my story and going public with my story and working with Endometriosis Australia and coming to events like this is purely out of a place of frustration and exhaustion, and I can't keep the facade up anymore. I have to be honest with where I'm at. And it's changed my life. It really has. And so I am 37 now. And as I said, I was diagnosed at 19. It hasn't been an easy road, but almost 2 years ago, I welcomed a baby boy into the world. Thank you. And he still makes me cry. And that makes everything worthwhile.
Do you think, looking back from when you were 19, first diagnosed, to where you are now, do you think that the tide is turning in how we discuss endometriosis?
Oh, absolutely, absolutely. As you said in the introduction a little bit earlier, about 5 years ago, I think is when I feel like it started to turn from a mainstream media perspective. We started talking about it a lot more. Endometriosis Australia, of course, I'm very passionate about the work they do, and they have been at the fore of leading these conversations. We're seeing government funding. We're seeing the health minister, the federal health minister, stand up and talk about funding for endometriosis and the like. And this conversation has changed drastically. Of course, like so many women's health issues, we have a very long way to go, and particularly in our regional centres, because it's our young people in regional centres, actually, people of all ages, that struggle to access the healthcare that we are so lucky to have here in our metro centres. So for me, it's really important, and I will just refer to my notes so I don't get anything wrong here, but Endometriosis Australia is working with ensuring that we get 100 nurses trained with the Australian College of Nursing specialising in endometriosis and pelvic pain. We want 100 nurses so they can go out to our regions, they can go out to our centres, and they can offer that support to these patients. And so when you come in and you see your nurse, that nurse knows what you're talking about. That nurse can understand those symptoms, because I know, having gone to doctors for would have been 6 years, no one knew what was happening. And it took a surgery, it took, as we know, that's how you get diagnosed, through a laparoscopy, to go in and to have a look. So we want to be changing that and having these conversations, raising the awareness, changing the dialogue with all genders, not just women, but with men as well, is really, really important. So I think we've come such a long way, I would say, in the last 5 to 6 years, but obviously we have a very long way to go.
Yeah, and a lot can change through education, advocacy, all the work that Endometriosis Australia and other organisations have been doing. Dr. Talat, this year you launched the first ever International Heavy Menstrual Bleeding Day through your charity initiative, Bleed Better. Can you talk us through what that was like and the response that you received from that?
Thank you, Olivia. So I've always had a passion for looking after women with abnormal uterine bleeding. It's now bordering on a bit of an obsession, but anyway. So basically, like someone else mentioned earlier today, this basically started from a place of indignance. When you have a niche interest, what happens is that you obviously get referred more patients with the same condition, and we have a lot of trainees and medical students as well through our practice. And it was one trainee that said to me, after a month of sitting in with us in our practice, who said, "Is Australia a developed country?" And I thought, oh, like, really? Is it? She said, "I have not seen this much anemia and this much single number ferritins, which is iron deficiency, previously because I work in the northern beaches. Most of the women I look after are quite educated, very articulate. They're quite health aware in general. They're looking after other parts of their health journeys." And she said, "I can't believe that the menstrual literacy is so basic. And how could they put up with this? How could they be so unwell before they've sought care?" So that was where it started. I was like, really, we have to do better. And heavy menstrual bleeding affects 25% of women of reproductive age. So let that sink in. 1 in 4 women will have heavy bleeding. And it's typically clustered more. Of course, it can be at any time in a person's health journey, but it's more clustered to the reproductive ends. So adolescents, and also on the other side, perimenopausal women. And so, and roughly statistically, Olivia, half of women who have heavy bleeding don't have pain. So it's so commendable. I tell you, I fangirl Jed Kearney so much, and the work that is being done for endometriosis is just phenomenal and so needed. But that is not going to be the only net to capture people with heavy bleeding, because heavy bleeding is actually more common, and half of women are not going to have pain. So that group remains as an orphan of our system currently, somewhat. So basically, back to your original question. So I thought, okay, right, what can we do? What can we do to raise awareness? And that's when I started checking, and I thought, it doesn't have a day. And heavy menstrual bleeding doesn't have a day. It affects a quarter of women. Why doesn't it have a day? And then I'm looking more, and I'm finding some, and it's not a competition, I swear to God. There were some things that were 3 in 1,000. I didn't even know some of what the diagnoses were. I had to Google that to find out as a doctor what that condition was. And I thought, great, that has a day. I'm really happy. But why doesn't heavy menstrual bleeding have a day? So I thought, okay, fine, let's set up a day. And I thought, if I wrote to some international, really big organizations, they'd be like, what a great idea. How come we didn't think of this first? None of that happened. So I was like, okay, no one even acknowledged or wrote back to me. Great. So, but at a domestic level, can I just shout out to RANZCOG, which is the College of ONG. Where's Ariel? Can I see him? No. Anyway, hi. So they were the people who I wrote to, I contacted, and they said, yeah, we think it's a great idea to have an International Heavy Menstrual Bleeding Day. We think that's something that affects a quarter of women. It's something that's worth raising awareness about, particularly because the research currently shows that half of women who have heavy menstrual bleeding have not seen a healthcare provider. So they are in our community, they are in their homes suffering and have not been able to see a healthcare worker. So this is actually a really big public health issue. And then the knock-on effects for some of them is that they're iron deficient or they're anemic. And some of that group are then going to fall pregnant, which is going to make that even worse. So there's sometimes a group of women that are on a very negative trajectory when it comes to iron deficiency and anemia. So, but anyway, back to the original issue. So then, you know how it is when I'm learning, because I'm a mere clinician, but I've learned a lot in the advocacy space. One thing I've learned is that there's a big thing called FOMO. So by the time 2 or 3 organizations give you a letter of support, the others are like, much easier. They're like, yeah, we think this is a great idea too. So it was really lovely that we got like 10 or 11 really major organizations, including our colleges, some universities, people who had an interest in women's well-being, who said, yep, we think this is a great idea. Obviously, from a funding point of view, we're still begging for coins, but we're hoping that, you know, that initiative has been started. And the name Bleed Better, we'd really thought through that, because I wanted it to highlight that sometimes the solutions are not perfect, because I often have women that will sit down and say, oh, I'm worried about the side effect of this, or I'm worried about this. And I'm like, I try to tactfully bring the conversation back to, look, the baseline is pretty ordinary. You know, you can't go to work 4 days, and it's a quality of life issue. Heavy menstrual bleeding is actually a quality of life issue. So if it impacts physical well-being, i.e. you're tired, short of breath, you know, any of those sort of physical features, it's a problem. If it affects emotional or mental health side of things, we know how many times anxiety can get so much worse when you have, you know, flooding to look forward to. And then social side of things, so if I have so many women who will say, I can't go out with my family, etc., or even material. We know girls that are curled up in bed, they can't participate in sport, they can't, or women who are at work and are less productive because they just cannot manage that whole cycle of heavy bleeding and the iron deficiency, the impact that it puts on them. So that's where we are now. So we've had the first, it's on the 11th of May. Please watch out for it. Please kindly share it when it comes out. It's an intention to raise awareness and then eventually, hopefully, to optimize access, to request funding, and to be able to deliver better care for women with heavy menstrual bleeding.
Yeah, put it in your diary, 11th of May,
Thank
2025.
I also, wanted to acknowledge the really good work around heavy menstrual bleeding standard. So this is by Australian Commission of Safety and Quality in Healthcare. So they have updated a standard. It's a standard that's meant to set, you know, recognize that, you know, a hysterectomy is not the only way to manage this. There are heaps of other options. And I think this is what makes it really hard for me, that women are suffering when there are so many medical options, there are surgical options, there are radiological options. And I think that that's important for them to reach out for that support. Thank you.
When we talk about menstrual health as well, another facet of that is accessibility to period products. And I want to bring Rochelle in now, because at Essity you've been at the forefront of championing greater equality and greater access to period products. Why is it such a critical part of supporting people who menstruate?
Well, within my company, we've been manufacturing period care products here in Australia for 40 years, and we've been researching women and periods and young girls and their experience with periods for many, many years. But a lot of what I'll talk to you about is the most recent study which we've done, which is about focusing on the impact of women having periods in the workplace. So I guess there's 3 really practical things that providing access to period care products does. The first is around period poverty. And it might surprise a lot of people that even women who work, we've sort of found from our research, there's probably about 20% of women who work that sometimes they have to choose between essential products and buying period care products. So it's not, you know, it's not just a problem for people who are, say, homeless and things like that, but it is actually affecting people who work. So addressing period poverty is the first obvious thing. The second is it's just really practical to provide period care products for people. Again, our research shows that there's a very high majority of women that have had their period unexpectedly. I'm sure everyone in the room that's happened to, and also a high majority of women haven't always had the product available when they needed it. So it's just a very practical support thing that you can do. And then the third aspect of providing period care products is around that emotional support. And surprisingly in the research, that women who had access to period care products at work, I think it was something like 78% of them felt less anxious at work because the product was there and available for them, which is a really, really high number. And I think people earlier today spoke about the mental load. I mean, because we make period care products, we've had them available forever in our office, and people busy full lives. It's just one very simple, less thing to have to worry about. So I think just getting rid of that anxiety and anxiousness and, oh geez, I've always got to make sure I've got a stash in my drawer at work, that sort of thing. Just take that away from people. It's a really simple, easy thing to do. And another really interesting thing that we looked at, and you get a bit nervous sometimes when you do this research because you're not going to sure how the numbers are going to turn out, but we asked about a range of things that organisations provide for people today, from coffee machines to biscuits to fruit to, gym access, as well as period care, to understand how important people thought it was to provide all these different things. And from the response from over 1,000 women, providing access to period care products was the number one. So that was a relief. So that was number one, followed by the coffee machine. But I have to say, we asked the same question of men, and it was nice to know that there was support for men as well to provide period care products. 50% of men thought that was a good, important thing to do, but they did rate the coffee machine higher than the period care products. But, it's nice to know that a lot of them still supported that. But anyhow, despite being so important, or felt to be an important thing to provide at work, there's only about 15% of organisations that are doing it today. So it's a big gap there and a good opportunity for us all. But then just lastly, it is around the stigma and embarrassment and taboo about having periods at work. And again, from our research, we know that people, when you're on your period, you've got to go to the bathroom, and people will avoid eye contact with people walking to the bathroom because nobody wants anyone to know that they're on their periods, or you're going to hide your product in your sleeve or your pocket and things like that. So for something that happens 12 times a year to half the population, it's a long way to go for us to not have to hide that on a daily basis at work. So I think a lot of positives can come from it.
Yeah, I thought we might do a little interactive activity here, bear with me. I want everyone to put their hands up if you've been in a workplace or your employer has provided free tea, free coffee, free fruit. I know I have, I don't know. Yeah, so a fair few. Keep your hand up if your employer has also provided free period products. Oh, okay, that's a lot more than I was expecting actually. But I mean, the number that you gave was 15%, right? Why are workplaces and employers so reluctant to provide something that is, as you said, such a simple way to address this gap?
It's even though we've been in the period care game for a really long time, for us to provide a solution there for commercial businesses is quite new. So we're really at that early adopter, it's the whole innovation life cycle phase. So we're really at the start where it's quite progressive organisations, and certainly we're finding a lot of companies in the healthcare space that are the first ones to get on board. So we're really at that innovative
That's probably
stage.
Why most people put their hands
exactly.
up.
I think we're talking to the converted in here, or people who care about wellness.
Yeah.
But it is certainly not the norm for other organisations. And what we're really finding when we go out to organisations to talk about this great opportunity to support your women at work is that we need to talk about ROI, and we need to get executive sign-off. I'm not sure that the executive signed off the biscuits or the coffee machine, but quite surprisingly, this sort of has to go to that level within an organisation to get sign-off. So that's actually why we've just conducted this research right now, to really properly understand the impacts and the ROI and all of the kind of commercial benefits to organisations. So we want to do that to help to bring organisations along that journey, so that our ambition is this is provided in workplaces everywhere by 2030 is really what we want to see. And if we've got to do that research to help educate people to understand the impacts, we're happy to play our role in that.
When we talk about accessibility to products, it would be remiss of me not to mention intersectionality. I just want to go through some statistics about accessibility to period products for different communities in Australia from a research from Share the Dignity earlier this year. It found that more than 80% of Aboriginal and Torres Strait Islander people have struggled to afford period products, and 21.5% have not been able to afford products at all. 83% of gender diverse people are experiencing period poverty, and 78% of people with a disability have found it difficult to afford period products. I'd like to hear from the panel for this question. I might start with Dr. Talat. Why do people from diverse backgrounds face higher rates of period poverty?
I think it's multi-layered. First of all, they might be new migrants, or they might be refugees, or that have not got a social setup in place, and then maybe there might be other groups that are coming into it with less awareness, and so therefore are just putting up with what they have available. And it is a very multi-layered issue. There might be language barriers and lack of, not only access but awareness. And I think that we have to face the elephant in the room. The cost of living crisis is a very, very big barrier now for Australians, and that women typically are then, at the, how should we say, the chop that was described earlier, or the crumbs under the table theory, that they will then be the most impacted by this. And so intersectionality, we know, whether it is in this context or in any context, adds to the barriers that women face. And so I have no doubt that they are struggling more with period poverty, and they need to be identified as priority groups to support in their own context. So even if, apart from period poverty, even if we're talking about awareness, like many times I think that we might, for example, translate a pamphlet and give to a community, but it would be better if we had lived experience from that community, somebody championing that in that language with a clinician who speaks that language, so that, again, there is more recognition of menstrual issues, whether it's menstrual pain, endometriosis, or heavy bleeding.
Yeah. Julie, did you want to add anything to?
Well, I was actually going to ask Rochelle a question in relation to the workplaces. Do we think it's a reluctance to be showing support for the female staff and providing services like this, or is it just a lack of awareness? Is it that, I don't want to have a dig at management here, but is it just those in management aren't conscious of the situation?
Yeah, it's a great question. I think we're speculating because we're experiencing a lot when we're talking to customers, so it's sort of speculation. But I think because it is new and people think, oh, this is an extra added cost, we have to justify an extra added cost. So it's sort of going through those hoops to get through that process, and not to say that everyone's going to come on board eventually. I'm really confident in that, but it's just taking a lot longer to do it than you would think that it would need to be. And again, from our researchers, there's just a lot of commercial benefits to it. So we probably estimate it's about $20 per year per menstruator to provide this at work. And if you calculate, that's 50 minutes of somebody working at the minimum wage, and I'm sure a lot of organisations, people earn a lot more than the minimum wage. And in terms of that 50 minutes, we know that people will spend more time at work, they'll be happier to work in the office rather than at home, they'll spend less time, leaving early or showing up late, or, there's just so many things that the productivity would just go out the window. And, again, if you had a staff morning tea, that would probably cost the same amount of money. So it's a little bit hard to get your head around, but again, that's why we really want to do this research to change that.
Yeah. Do governments have a role in this? I mean, governments have been stepping up in terms of providing period products in schools. A lot of state governments have been doing that for high schools. WA have done it for primary schools. We saw the federal government also invest in period products to remote Aboriginal and Torres Strait Islander communities. So what about workplaces? Should they be putting in some sort of policy or investment for that? Rochelle, I might start with you.
Yeah, I definitely think that governments have a role to play in this, and even with the work that we're doing, that really started from the Victorian government being the first in this region of the world to provide free period care products to schools. So we won that contract. We're manufacturing in Victoria, so it was great for us to win that, to supply all the schools there. But that enabled us to develop a proper dispenser, to go into the bathroom and get the product set up so that we could take that into workplaces. So without that Victorian Government Schools program, we wouldn't even be offering something that can be used in commercial businesses. But I think there's great momentum in the school space from a government point of view, and we're seeing in Victoria and the ACT that they are going to be providing free period care products into public places. So that could be libraries or schools or hospitals, a whole raft of things like that. So that's a great step forward. But to your question about workplaces, the first that we have seen to do anything is actually Canada. So at the end of last year, they mandated that all federally managed, controlled workplaces have to now provide free period care products. So in Canada, that includes all the public service, it includes banks and airlines. And I think it is a really important thing for governments to do that, because then others follow. And, you know, I draw the analogy of paid maternity leave. So here in Australia, it was the government made paid maternity leave for the public service in 1973. And it wasn't until 2011 that everybody in the country got access to paid maternity leave. But I know I had my daughter in 2006, and even though it wasn't mandated, because the government had started it first with the public service, that prompted a lot of organisations to do the same thing. So I definitely think that the government taking the lead, others will follow. So I think it's really important.
Dr. Talat, what do you reckon?
I think that that's a wonderful initiative, and it's so much needed. And obviously, I see women with very profound, like the cohort where mostly they're having abnormal periods, but those are even more heightened, you know, stories that in terms of suffering. So I hear so many times my patients will say, oh, look, I had to run to the nearest toilet. I couldn't come out. I was stuffing toilet paper in to try and control some of the bleeding. Or things around, one person who's allowed me to share the story said, I collapsed at work and at least now my boss believes me. Or, you know, all sorts of, it's so difficult to have that kind of person not supported, and I think it's very important to create that. And it's the other issue is that sometimes with heavy periods, women do trivialize their symptoms themselves because they may not know, or I think we're just champions. We multitask, we tend to put up with things a lot, and so we just say, oh, look, this will be fine. Or even when people describe their periods to me, they will say, oh, it's really bad, but it's only just 2 days or only 1 day. So even the words that we use to quantify can sometimes be trivializing that issue. And back to your question, I think it's so important to have that as a policy so that women are supported.
Yeah, it's a good way to segue to my next question, actually. I think this fear of discrimination is standing in the way of a lot of workplaces providing that support, or employees accessing that support, rather. Women are often reluctant to request leave or support, even when they're suffering from conditions as severe as endometriosis. Julie, I want to hear from you. How can workplaces be more understanding in conditions like endometriosis?
I think it's so important that we start with conversation. We shouldn't be afraid to mention the word endometriosis or any other type of condition. I can obviously only speak to my experience. So we should be making people feel comfortable to have these conversations. I've been very lucky that those around me, once I put it out there, became very, very supportive. And I'm so proud of the men that I work with who in the media or even not in the media talk to me, ask me questions, ask how I am, read articles that I've written or been in, and ask questions. And, you know, I've just done a new autoimmune protocol diet. Ask me about that. How am I traveling with that? So I think it starts with conversations and making people feel safe and comfortable and supported. It also is so important that, unfortunately, with conditions like this, there is a lot of sick leave. There is a lot of leave to go and have surgeries. There is a lot of leave to see specialists, and that's just at the early stages. And then there's the maintenance stage, and then if you're going into the fertility stage. So there's so many chapters, so many layers. So we need to make sure that people feel safe and that your job isn't at risk if you're trying to deal with your health. You know, we shouldn't feel afraid to say, this is the situation, I need to go and have a surgery, but I promise I'll be back Monday because I'm too scared to lose my job. Having worked in the media for such a long time, that was my fear. I was so scared that I wouldn't have a job the next week. So I did push myself physically, which means I push myself mentally, which means I push myself emotionally, which is this vicious cycle that we've just heard about earlier. So, you know, and again, just to reference my notes, but Endometriosis Australia, in conjunction with Western Sydney University, is currently working on a great research program to deliver the world's first evidence-based workplace program. Now, this is designed for workplaces to support staff with chronic conditions. So this is all about bringing our workplaces together. So if you have a chronic condition such as endometriosis, you feel supported, you feel empowered, you feel like there is equality to the next person that goes and gets COVID or gets a cold or whatever it might be. So really, it starts with the very simple steps, which again, we've spoken about in this afternoon's session. It's a really simple step. It's making people feel safe. It's making people feel comfortable to have the conversations. It's making us make sure we don't feel like we're about to lose our job because we happen to be female and we happen to be having these issues. And it's supporting them in the best way possible. My workplace allowed me to come here today to talk about this. My workplace allows me to have my name in the media to talk about this, So it's really simple, but it's so important people listen, and it's so important that people feel like the door is open, they can walk in, sit down and have a conversation about it when they need that support.
Yeah. And it is all well and good to be talking about it here in a room full of people who probably know what we're talking about. But I think it's time we get men involved in the conversation. Julie, you mentioned that you've come across a lot of men who have supported you through that. So how do we do it?
I'm so lucky I have a wonderful husband who has no filter. So he was never afraid to have the conversation with his mates. Yep. It's a very open conversation he has always had with his mates about my health, about our family experiences, etc. Again, it sounds so simple, but it's having a conversation. It's being okay to sit down and talk to dad at the dinner table. It's being okay to talk to your boss who happens to be male and not blush and not get flustered and not feel like, oh God, this is so awkward, I'm talking about women's health issues. That shouldn't be an issue, So I have been so lucky to have wonderfully supportive men, but I'm one of the lucky ones. I appreciate that. That isn't for everyone. The majority of my doctors and my surgeons have been male, and which my first female doctor was my obstetrician who delivered my baby. I've been supported and surrounded by men, so I'm lucky, but it's about starting that conversation and making these patients with conditions like this feel safe.
Mm-hmm.
I think that those are wonderful points, Julie. I just wanted to highlight that there was some research that we did last year. Basically, it's called Living Comfortably by Hologic, and it was undertaken by Two Blind Mice, a company called Two Blind Mice. But they sampled 5,000, there were 5,000 women, Australian women between 35 and 52 years of age, and 92% of those online surveys said they wanted more conversations to add to what you're saying. And I think that was what I found very heartwarming. It didn't tell us anything we didn't know. A quarter of women have this, half of them haven't seen the doctor. Lots of difficult statistics, but the one that I latched onto in there was that 92% of women want conversations around this. So we are today having this discussion with both men and women. And I think the other important part is that when we're targeting schools, we should make sure that we're including the co-ed schools, we're including boys' schools, so that everyone is part of the solution, and we're not only focusing on women, but we're looking at all of society to create meaningful change.
Rochelle?
Yeah, I just wanted to add, because we spoke to men in our research as well, and I think this gives a nice bit of hope for us all. So, not surprisingly, I think it was like 42% of men felt they didn't really understand the impact of periods for women at work, but 56% of them wanted to know more and to understand. So I think that shows great support for women to wanting to, to learn more about it. But also when we asked men how comfortable they would feel to, if an employee were to tell them, I'm off sick because I'm on my period, or discuss their period care symptoms, it was over 50% of men said that they would feel comfortable to have that conversation. But the interesting thing is that, quite a lot of men felt comfortable to have that conversation, but there was more women that felt uncomfortable to have that conversation with their male boss. So I think that we can take that and be brave, because I think probably men are more willing and open to having that conversation that we might think. And if we do it, just sort of think, well, what's the worst thing that can happen? I think we can probably kick it off, and it's probably not going to be as bad as we thought it would be.
I think there is a bit of responsibility that falls on us as well. Men, sometimes they can be, but they're not dumb. And it's not hard to have a conversation with them, and they do want to be having these conversations and supporting us. They've got many women in their life who they love. So it really does fall on us to also start that conversation, because I remember when I first shared my story, I had so many people say, if only we'd known, why didn't you talk about it sooner? And that fell on me. That was my responsibility to take that first step. We can't force people to do that. So, don't underestimate those around you. They want to help you. They want to support. They want you to be well.
Yeah.
It's up to us to start that conversation.
And I agree with you, Julie. It is up to us. So bless my 80-year-old mum who texted me at work when I initially started this advocacy and said, oh, you're sharing on Facebook all these things about period. And my brothers are all on Facebook. I'm like, well, Mum, I'm a gynecologist. So over the years, she's learned to initially put up with it. And now she's like, I like your recent article. I'm like, whoa. So I think that we have to be part of the change.
Yeah. I grew up with 3 sisters, so it was just a regular conversation at the dinner table for me. My poor dad. No, not my poor dad. He's fine. I'm conscious of time, so I might just throw one last question to the panel. We'll start with you, Julie. What is one thing you would like to see in workplaces to better support its staff in terms of menstrual health?
Oh, that's a really good question. I'll probably steal Rochelle's answer. It's not hard to have products available for women in the workplace. In fact, I'm just still so alarmed that, and then I think back to where I work. I'm like, do we even have anything in there? It shouldn't be hard. I mean, I asked for hairspray in the bathroom the other day, so why can't we be having period products? I'm just a bit stumped on those numbers. So I'm sorry to steal your response, Rochelle.
Take the support.
Yeah, I would say access to information, highlighting what is normal and what is abnormal, so that people can then seek the care and be prompted, and perhaps even more detail around how to access that care.
Mm-hmm.
Well, I'll take it a little bit broader. Around having a menstrual health policy, I think, is really what is an important thing for organisations. So I think it's probably only about 10% of people that have that today. And, I guess before coming here today, I was thinking, well, that would include things around period care leave and menopause and education about periods and menopause at work, as well as access to free products. But I think I've got to add to the list after being here today. It's got to be talking about miscarriages and a whole heap of other things as well. So I think it's about having policies in place within organisations, and I think that can come from anywhere. And to steal, and I might be kind of stuffing this up, but I think was it calling the foul. I'm not sure if I'm using this in the right context, but I think any person in an organisation has the ability to go up to their organisation and say, hey, have we thought about having a menstrual policy and providing access to free period care products, just calling it out. Because what are they going to say? They're going to go, no, who wants to say that? Or actually, we've not thought about that, and it might just sort of spark that change. So even within our own company, I just want to call out Rachel, who's in our team here today. She has actually initiated conversations about having a period care menstrual leave policy within our own company. Even within our own company, we didn't have it, but it just took someone from our team to go and start talking to HR about it. And of course, they thought, yeah, that makes sense, and things are in motion. So I think it can come from anywhere to raise that conversation.
And maybe we can have some models. Maybe I got some funny stares from the Uber driver, highlighting what is abnormal and could be a cause for the abnormal periods, like fibroids, like polyps, like cancer, like adenomyosis.
The only problem with that is it's not big enough.
Yeah, I needed a bigger one.
Wheeled out uterus. Well, I think that'll wrap us up for today, but thank you so much. Would you please thank our panel?